It's February 4th, 2014. We're back in the office with Melanie. And this is now more than a week after we saw you the last time, correct?
Yeah.
And you want to tell the viewer what you've noticed in yourself since we did your treatment?
I've noticed a definite improvement. For 10 hours after the treatment, I had actually no facial pain at all. After that, I did have some return. It kind of comes in cycles. It feels like it's cycling down, and they're less intense, and they don't seem to last as long or as frequent, but they definitely seem to be triggered by moving my arms, physical movements, moving my head. Driving really is very difficult still. Mentally and emotionally, I feel like I can actually communicate with the world better now, because last time I was just in pieces.
To me, you seem like a totally different woman than when you were here last time. Turn your head to the right, please. And now turn it to the left. As far as you can. Don't turn your body. Okay. Now, please bend your head back as far as you can. And drop your jaw to your chest, please. No, your whole head down, mouth closed. That's much better than when you walked in the door.
Yeah, I couldn't do that before.
Right.
Remember?
Okay, so we made some good progress. Now, we haven't done any further work with you yet, but for the viewer, when I evaluated her just before shooting this, I found a level at C2, and last time we did C7. So today's treatment's going to be at the C2 level. Okay, Melanie, we just completed your second treatment. How do you feel at the moment?
I feel sore from the needles and stuff, which is expected, and I know what happens. But my body feels so much more calm, and my heart rate's lowered, and I feel like I want to take a nap, and that never, ever, ever, ever happens.
Okay, bend your head back. Bend it down as far as you can. Very good. Turn it to the right as far as you can. Turn it to the left as far as you can. Even more if you can. That's more than when you came in the door, wouldn't you say?
Oh yeah.
Can you go further than that?
I think it's the soreness from the injections right now. My body's kind of a little stiff.
Okay, you were telling me before also that your jaw seems to be functioning better since the first treatment?
It's realigned. It's actually realigned. The last thing my dentist told me, that my jaw was opening up, and then the lower part was pulling to the right.
Mm-hmm.
And the left side was actually, I guess, like what you would call TMJ, because it was cracking and popping. And he couldn't figure out why that was happening. But when he would numb my jaw, it would stop. It would realign it. So somehow it was getting into my neck from here, I guess, because since the first treatment now, my jaw feels so much different, and eating is not as painful anymore. Chewing is not as painful anymore. It feels like everything is winding down. This did not come on like you have a car accident and all of a sudden you're in chronic 10 pain. This was a slow process that happened. I deteriorated over time, and I do feel that physical therapy played a part in it, because they didn't listen to me when I complained, and they didn't monitor me the way they were supposed to. I don't know if my previous health history contributed to that. I tried to be as honest with them about everything, but when I came to them, I was in such a chronic state, and I've been walking around like this, bent over, for about 2 months before I got to physical therapy. So part of what's happening is what I believe is retracing, which I learned from chiropractors. Your first pain is your last, and your last is your first. And I feel like I'm getting to the first pain, and like I can live again. And I didn't feel that way when I was here last week. I did not feel that way at all. And I've never had psychological problems. I love myself.
You're a hardy lady.
And I'm a strong, robust woman. I've always been able to safely lift between, 60 to 70 pounds. My whole life, I've always been strong. I've never done anything that I felt I couldn't do. But to be to the point when I came to you last time where I couldn't even pick up my arms. You had to actually physically lift them for me. I couldn't even do this.
Yeah, get them above your head now.
I couldn't do this, and it was nothing to do with the shoulder. They would not move. It was my neck. It was my neck, and now I don't feel like I'm crazy anymore, and I feel like I will recover, and that I have hope, and it's because of you, and I'm so grateful.
Well, it's your body that's healing, dear. We just have to trigger it to heal. Let's see you put your arms above your head again. And that's correct. You couldn't even do that before. You needed my help.
Not without triggering face pain.
Yeah.
If I did it on my own, it would immediately trigger something in my face.
Mom? What are your thoughts on what's happened here?
Dr. Rowan, you're a saint. You know that. It's been a hard road. After the first injection, she had a lot of, she fell apart a lot. Had a lot of hard days this weekend, but right now we're having a great day, and she looks so much better, much better. This is fantastic.
Good, thank you.
And you've saved her life and my life. We will be grateful forever.
Well, you're sweet for saying that.
It's
You
the
know
truth.
how I feel about healing. All healing comes from the higher source.
And you taught us that. And nobody's ever taught us that before. It's taking me, I'm almost 65 years to finally learn that I can heal my own body with the help of the right doctor. You have to find the right doctor.
Yeah, there's assistance there. I think
Yes.
that's the way the world is
And
made.
everything is all connected.
Yeah,
And doctors just chop us up too much.
yeah. Thank you.
You're welcome.
Today's February 11th, 2014. We're here once again with Melanie. And today she's just had her third prolozone treatment to her neck. She came in quite emotional for things going on in her life, not exactly related to what she came to me for, but a lot of emotionality. So I didn't record her before the treatment, but I do want to record her now after the treatment. So Melanie, I'm going to ask you to turn your head to the right, please, as far as you can. Don't turn your body, just your head, as far as you can. All right, now the other way. All right, now bend your head back as far as you can, please. As far as you can. Touch your chin to your chest, please. Chin to chest. That's all the way down. Let's get the scarf out. Excellent. Wow. Okay, look straight ahead. Now get your arms above your head, please. Straight up. What do you
Doesn't hurt.
Doesn't hurt.
It was all this pounding pain in my face when I came in, and my whole body was shaking, and it's gone. It's all gone.
Right. And
And
I want-
and my heart rate's better than last time, and my blood pressure's better. So my body is trying to heal. I
Well-
have to get a hold of my emotions.
yes, you came in today much better
Yeah.
than when I first saw you. And the reason why
Physically.
Physically.
That's right.
Physically.
Physically.
And the
That's what
reason
you're here
why-
for.
Right. And the reason why I didn't video you before I did the treatment is because I didn't need to have all those emotions on the screen.
No.
All right.
It was hard to talk. So.
Yes, but that's something you
That's
need
connected
to work
with
through.
my neck
Of
too.
course.
That I'm starting to realize now, because when I started having problems speaking, my mom immediately started thinking it was something serious, and I know from my chiropractors that the C2 is related to speech and swallowing, and that's why I can't eat sometimes. So you can only fight things the natural way, and that's what I know, and that's what you taught me. And that's why I'm still here.
Well, we've made really unbelievable progress with your head and neck.
Oh yeah, I was
And-
able to go to the beach yesterday. I haven't been there in over a year.
And I can't control your emotions.
No.
All I can do is try to point you to some things. And I did suggest that you read the book The Vortex, and you also told me you have The Secret. That deals with the law of positive attraction, and I think that can help you out a lot with the other stuff
I
in
think
your life.
getting the pain down is helping me control the emotional stuff too.
That's-
The pain was kind of
Yeah.
the emotional stuff set off the pain, and then since you address the pain, now I don't feel so hopeless.
Excellent. I'm glad. I want to ask your mom something. What do you think of what you just saw in her range of motion?
I think it's a miracle. It's unbelievable. I can't believe
Now,
it.
she's got basically normal range of motion in her neck right now.
Yes, definitely. She's
Okay.
doing much better.
And when she came in, I would say she had lost at least 50% of her motion.
Yes.
We videoed that.
Yes.
And she couldn't get her arms up.
Right, and she trembled. She had hard time talking, and now seems so much better.
Okay.
So much better. Thank you, Dr.
Thank
Rowan,
you.
again.